I think we've got an opportunity in Massachusetts to markedly improve the patient experience, but I think we're at risk for losing that opportunity. And the reason I think about that is only 50% of the time are we delivering the type of care that we know is appropriate care. And I'll talk a little bit about why that isn't the case. And why haven't we delivered more compassionate care historically, despite every provider's inherent desire to do so? Nobody goes into medicine as a doctor or a nurse or any other type of provider thinking I'm not going to provide compassionate care. Patient centricity was nowhere on the radar screen during the time that I trained or when I was practicing medicine. We selected for individuals to go into medicine who didn't necessarily have compassionate inclinations. In fact, if I think back of who was pre-med when I was in college, we self-selected for the least socially comfortable and adept individuals. And that's not a criticism, but it was the grind that they were subjected to, and so we got what we bargained for. It's good to know that the new medical care admissions test in 2015 includes a section on behavioral and social sciences in recognition that behavioral and social factors play a huge role in health. Probably most important in my mind, there's never been any type of financial incentive whatsoever to deliver the type of care that we're talking about. And in fact, there has been a disincentive because to deliver that care well takes time and effort, and in a fee-for-service world, time and effort is measured by the number of patients that you see, the number of procedures that you do, how often your MRI machine is humming all day and all night. So there was that disincentive. Schwartz Center rounds have been shown to foster enhanced communication and much better communication skills for folks who participate, enhancing the relationships between providers and their patients. One of the articles that I read talked about 55% of both patients and physicians believing that our system provides compassionate care. 45% recognize that it does not. And an interesting recommendation from Schwartz Center staff that national quality standards include measures of compassionate care. Pay for performance works. I describe my physician colleagues as a very myopic, narrow vision, tunnel vision species. However, we are educable, and if you provide people with information about how to deliver care in a different, more efficient way, and you pay them to do so, people will respond. Compassionate care and communication improves health outcomes for patients with chronic disease, diabetics, patients with pain, patients with anxiety, cancer, and on and on. Cost of care goes down, quality of care goes up. Readmission rates go down when compassionate care is delivered. Patients with advanced cancer who have end-of-life conversations early have much less aggressive treatment and longer life. Seems like an inherent contradiction. Lower cost, less aggressive treatment, and they live longer. Greater trust by patients of their physicians. Better communication has been shown to lower inpatient mortality for heart attack patients because they're more compliant with the recommendations and treatments that are given. So nobody should be surprised by any of those results. We know it works. I am confident that we can and we will make the right choices to get us to compassionate care, but it's going to take everybody who's in an influential role, who has relationships with people who are able to make these decisions, to weigh in. We have the tools that we need to do this a whole lot better. We've got the roadmap in front of us because organizations have done this well and focus on it every day. We have to make the right choices, and I'm confident that we will if we pay attention to it.